We're watching and looking at the trends, and certainly, I think in the country, Gauteng is still at the top of the rate of infection. KZN is taking over now, and therefore we're going to be discussing with them how to move ahead so that they don't get caught up with the numbers. It should be possible to make sure that whoever the patients that they have to admit, they don't have a challenge with beds, with oxygen, and that the turnaround times also are reduced. With all of that, I'm quite comfortable with the approach. Our clinicians are quite on top of the game, and they've got good enough experience, and we can see the impact. And so from that point of view, I think we're going to get somewhere. So today, basically, what we are really up to is to just see how things are kind of tying up in terms of additional beds being available, so that no one should be turned at the gate to be told that there's no bed available for you. There are those who may not be admitted. That's because of the doctor's decision. So when the doctors decide that you don't admit the patient, that's it. That patient will not be admitted. And so it should not be because there's no space. It will be because the judgment, the clinical judgment, is that you're going to be treated somewhere else, not in the hospital. So I'm quite comfortable with that. And I also think that the reduction of trauma patients is a huge advantage for us. It's going to help us to deal with the next few weeks. And so that's it. We'll be going around just to make sure that Gauteng is able to show readiness